Admissions in the U.S. soaring past 65,000, a record.
100,000 plus gone.
More than 15,000 new COVID cases this week.
Declared an emergency and is now imposing a mask mandate. ABC's Alex.
In March of 2020, the world was rocked with the spread of the coronavirus. What started as a few cases overseas quickly escalated into millions right here at home. In the coming months, hospitals all across the country were inundated with patients battling a disease that no one knew much about, including how to treat it. As college students everywhere returned back to campuses and people nationwide grew tired of masking and quarantining, cases have continued to rise and spike, even now, 9 months from the onset of the pandemic.
Amid all of this crisis, medical staff were expected to be there every step of the way. Media outlets coined the term frontline healthcare workers and brought awareness to this population of hardworking men and women that were fighting this disease nonstop, day in and day out. However, in creating that population, they left out a large portion of it. Doctors and nurses everywhere have made great sacrifices to stop this pandemic, but what about the frontline we don't hear about?
It's the environmental service staff workers that sanitize every room between patients, wipe off every elevator button, and clean every stairwell to make sure that the hospital is clean and safe for every new patient that comes in. It's the lab technicians that run COVID tests all night long to make sure that people have the rapid results they need to continue on with their lives or start getting treatment. It's the paramedics and EMTs that answer hundreds of 911 calls and treat people in ambulances, not knowing whether that patient has COVID. It's the volunteer firefighters that perform COVID tests at Rice, never even being told if someone from their testing site tested positive.
Mary Jackson is one of these unseen frontline workers. Jackson is the operations manager for facility operations in the Women's Pavilion at Texas Children's Hospital in Houston. She's worked at the hospital for over 30 years, and she manages all of the environmental service staff in the hospital. Just like the coronavirus was new to you, it was new to hospital staff too.
Starting, I think, around March, when COVID actually came in, it was like something we never saw before. We're used to doing all type of isolations, from MRSAs to airborne germs, all those type of things, but this was something new to us. And so even myself and my team were fearful.
To help combat the virus and keep patients safe in their visits, Texas Children's has taken several precautions. All of their staff learned new procedures, had to wear more PPE, and became even more cautious themselves.
One of the things we had in place through Texas Children is they made us feel safer, because the next day when I walked in, it was amazing that soon I hit the front door, we already was being stopped at the front from what I normally would do, just come in and go up the elevators and be in my office. But that changed. We all had to check in. We had to have our temperatures checked. We had a questionnaire that we have to complete, and we're still doing that. And we were also given a band to identify, right here, a different color band every day to identify that we went through these precautions and procedures. So again, it was very weird, or not knowing the knowledge of this virus that was out here. Since that time, we have evolved with all the right precautionary measurements that we have to take to clean with. So we have everything in place, which is our Oxyville wipe that we've been told to clean COVID rooms with and COVID services and everything with. Extra precautions that we've taken now is that we're cleaning our elevators on numerous times a day on each shift with the same thing. Elevator buttons, frequently touched areas. We've increased our time for cleaning public spaces more. So again, with all this, to make sure that we're in compliance and making sure we keep the germ, minimize it down to anything, because we still have patients that's coming in front doors.
Hospitals across the country are implementing similar procedures to ensure their hospitals are clean and prepared for any incoming patients. And while this is necessary, did we ever consider how this affects hospital staff? Mrs. Jackson was watching her job change before her eyes, and it wasn't easy.
I was very fearful. And the other thing was going home, that I work in a facility like this, and I have grandkids and I have kids. And my whole thing is, when it first hit me, it was around Mother's Day. And I have a family, we're always together and everything. So this Mother's Day, it was a little different from me. My fiance actually went and bought me a storm door. I've been wanting one forever. Never got a chance to get it. But this year I got it, because this year My grandkids had to see me through a storm door, through a glass door, because I work at a facility like this and I didn't want to take it home to them or anybody. My sons and my daughters, they weren't able to come over. I just actually at that time said, hey, I'm not for sure what's going to happen. So I advised them to stay away from me. So we were doing Zoom and we were doing FaceTime and everything, but it wasn't the same. And the hardest part was when my grandkids had to come to the door and touch the glass door to talk to me through the glass door and do hugs that way. That was very, very hard. And that's when it really hit me that I knew something was bad out there.
One of her biggest moments of fear came from her staff's first experience with COVID.
First experience with one of my housekeepers being called for the first time. We got a call that said we had a COVID case. Again, we were very unfamiliar with how to clean these areas. Of course, our infection control at that time told us that it would be our germicidal that we have, which is bleach. So again, I sent a housekeeper up to the floor, not knowing it was a COVID because we're always clean in isolation. We were only told like, hey, it's an isolation. So generally I'll call this employee to go up. But once she got to the unit, it was a COVID case. And it was like, oh, wait a minute. So I go up to the unit and seriously, my employee was tears in her eyes, literally crying because again, this is something we're all unfamiliar with.
Guadalupe Mendoza is a lead tech at Texas Children's that works under Mrs. Jackson. She spent 19 years at TCH, and in her 19 years, she's never experienced anything quite like this.
That was something that we didn't know about it. We didn't know what was causing first, because mostly for me it was all on the news, and they didn't know what was causing it, how people were getting sick.
Mendoza is responsible for helping staff members get PPE, and this process has changed drastically with COVID.
With management and infection control, keeping in touch with the managers and letting them know what else do we need for us as housekeepers to clean a COVID room. And like I said, besides the PPE or eyewear, we started, I told Ms. Mary, I need to take that. It's like, we started with, as you can see, mine did too. We started with these glasses. Now we went up to more, to finally near like, you know what, we need more protection. And like Ms. Mary said, Texas Children is always providing us something. Yes, all this, and besides our staff to get the Activeair tubs, to get the area clean and all, and I mean, we are covered up. I myself, I clean COVID rooms. Well, I'm a housekeeper. If I lead tech, yes. They're busy. I go in and clean the COVID room and everything. We all wrapped up too and everything with our PPE, a glass aware.
Mendoza says even with all the changes, she knows that she needs to do her work to help support the doctors and nurses and keep the hospital running. Just like Mrs. Jackson, she misses her family, but it's a sacrifice she makes to help every patient that comes through TCH.
We like always the freedom, just to go out there and enjoy, be with your family, sit around. And now it's, for me, I don't have none of this Zoom or I just talk with them. I just talk and see how they're doing. Just keep in touch with them, see how they're doing. And my brother had been sick. And it was in April when he ended up having that stroke and all this new stuff. And we didn't know what it was. And to find out, not being there. Mostly it's not being there for your family, right there in person, so the doctor can tell you what's going on. And then that waiting, trying to find out, to call his daughter, and then the daughter passed it on to one family member, and they pass it down. So that was kind of hard, very, very hard.
Every day, Mendoza gets updates on COVID cases on her team, and every day, it's still something that scares her.
I didn't know, scared. What can we do to prevent myself of being safe? I'm coming to the hospital being safe, trying to stay safe. But I knew about the PPE, the eyewear, the mask. Coming to the building, they check everyone, the questionnaires. They got to answer, and we got to show them that they got questionnaires, that what kind of symptoms. And we do have a little cough, a little fever, we gotta go home.
Mary Jackson and Guadalupe Mendoza are two of the many environmental service workers nationwide who have been overlooked in the discussion of the frontline.
When you walk into the organization, one of the things you look at is cleanliness. And like right now, so many people are fearful of coming into a hospital. But if they knew the hard work that we have behind us and the hardworking employees that we have, that 24/7, we are here cleaning tremendously, terminally cleaning. And again, it's from things that they would come in contact with of frequently touched areas like elevator buttons, restroom door handles, restrooms. We are actually cleaning all this space. As soon as you walk in our facility, we have doors that open so they really don't have to touch anything. Again, going up on those elevators when we have staff that's standing there to press the button so that these patients don't have to press the button at all. And then my staff again has like double their work what they're doing to ensure that the facility stays clean. Also the manager, but I get out there and work also. So we're hands-on as well. But my frontline employees, even if not me, would be the ones I would love to see recognized for a job done. Because again, they're going into these rooms just like the doctors and nurses, and they're going in afterwards. So no one is there. So they have to be very precautious, put on every single PPE because that room is still considered contaminated with COVID-19 until we go in and disinfect and clean it. And the thing about it, the recognition should go to my staff again, is because when that patient comes into the room, it's not about the doctor or nurse. They're really wanting to know, is that room really clean?
The front line also extends beyond the inside of a hospital. COVID patients can be found inside of an ambulance working with a firefighter paramedic like Robert Trevino. Trevino has been with the Houston Fire Department for 3 years. Similar to Ms. Jackson and Ms. Mendoza, he's seen lots of changes in his job that make doing it just a little bit harder. While Americans are complaining about wearing a mask in public, Trevino is putting on layers of PPE to ensure that anyone who needs an emergency response can get to the hospital safely.
That's one of the hardest challenges because you get annoyed, frustrated putting everything on. I know we get told wear a mask, gloves, and everything. I go above and beyond as best I can on that. Like, as far as PPE goes, I go above and beyond. Every patient, hand sanitizer. At work, every patient, hand sanitizer. Clean up the ambulance, everything. The full works for sure. Because you never know. It's airborne, and you never know. Like, hey, is he positive or negative? You don't know that. You find out till you're later.
PPE isn't the only change Trevino saw in his job this year. In addition to being a firefighter paramedic, he decided to become a COVID tester at Rice University. He puts in long hours and sacrifices his own breaks to help fight COVID.
Schedule goes 24 hours, and then we're off 24 hours, then we're on 24 hours, then we're off for 5 days. Okay. So it just alternates like that. So I work Monday, I'm off Tuesday. Work Wednesday, then I'm off for the next 5 days. Okay. And then for the COVID testing, well, it's Monday through Friday, 8 to 5. So what I do to double dip in both jobs. So like I try to find people to cover me whenever I work. Well, I work Monday through Friday there as a COVID tester. So if I'm working Monday, let's say I'm on shift Monday, so I'll have a buddy of mine cover me from 8 to 5. Then I'll show up to work at the fire department from 6 to 6 a.m. And then I just shower up and I go straight to work at the university. And a lot of guys coming in contact with these COVID patients, and we're getting sick too, We're getting sick too. If one of us gets sick, well, it's bad for the whole department because it just spreads. And we've had a lot of cases, a lot of the guys that have been out, and we have been getting short-staffed. And that takes a toll on a lot of the guys because you get held back, and sometimes you work 2 days, 3 days straight, and no one's there to relieve you.
Similar to Miss Jackson and Miss Mendoza, Trevino loves his job, and that's why he continues to do it, even with the fear of possibly getting COVID.
When you love what you do, you show up regardless. It is scary. Every time you go into work. I don't want to say it's not scary at the university, but it's more controlled there, At the fire department, it's way different because that's everybody's out and about, being crazy, you never know.
On average, testers at Rice can perform anywhere from 50 to 200 tests a day. That's 50 to 200 people they see every day that might have COVID-19. Some people even ignore their symptoms and come to the testing center sick, not thinking about the people they're putting at risk, which includes the testers who are already sacrificing so much to ensure that Rice can continue to operate. All the while, people everywhere are still ignoring COVID rules, and to frontline healthcare workers, it's frustrating.
I was one of those questioning, where did they get it from? Where they're doing their job and keeping themselves safe. Mostly a little bit of anger. Okay, then wanted to ask them, what happened? What got you here? I need to do my job. And at the same time, I need to do my job. That's me. I never told Miss Mary this. I never told Miss Mary this, but I need to do my job. But it's symptom too, is seeing on the news and all that was walking around with no mask and all this. I said, you one of those that was out there and now you're here, expect the doctor to take care of you and then expect our doctors and our housekeeping staff, but otherwise it needs to be done. It's just something that needs to be cleaned up. Well, as you can see through my eyes, because I saw a patient and we're talking about this is pavilion for women is where we get the mothers. We got pregnant women coming in here with COVID. And I will see the patient, but mostly it was okay. But then when I got to see one, she really had a baby, and that's her incubator. That was like, it was the hit. It's for real. All this news is fake news. It's not really. It's not for real. It's not happening. It's no COVID. It's a lie. No, it's not. When you see a mother barely having her baby, and then they had to incubate her. And then they take the baby and get it incubated to make sure everything's okay with the baby and all. Separate them. Not where a mother can give them birth and hold them. They don't do that. The mother she don't know nothing about it. She's being incubated. And I got to see one, and that was the hardest. It's for real. It is out there, and it's hard. Believe it.
For Trevino, he just wishes that they could see the front line.
If they would see what we see, then they'd think differently. They'd see it firsthand. They wouldn't, I would assume they wouldn't be doing any of that. If they would see firsthand, or even if they lost one of their closest relatives, I'd feel like they'd switch up on their thinking, and wish people knew how we feel. It's a sad feeling to see people lose their loved ones. I wish they could realize it's a bad time to be out and about doing stupid decisions, if someone knew how we feel inside, they know, Yeah. We see a lot of people lose their loved ones, We don't show it. You never want to show your emotions, but when we're alone and everything, well, that's when you get to vent,
Through long nights in the ICU and early mornings in the ER, 24-hour shifts at a fire department and afternoons in the East Gym, this group of frontline workers were forgotten by everyone. Yet still, they were expected to show up every day and fight our battle against COVID. While doctors and nurses were praised as superheroes, these frontline workers continue to work to support them, even without appreciation. And worse still, the world sees our essential workers as superheroes, and when they were put on that pedestal, everyone seemed to forget that the frontline is human all the same. They all experience fear of getting the virus, they all experience the sadness of losing loved ones, and they all experience the exhaustion of being at work nonstop, not knowing when they can expect relief. They all experience frustration from everyone who refuses to acknowledge the dangers of COVID, and they all experience loneliness from not being able to see their family.
This group is unseen but essential. They keep hospitals running, they bring COVID numbers down, and they keep their patients safe. They're as frontline as anyone else in healthcare and deserve to be acknowledged for their sacrifice and appreciated for their work. When you go to sleep at night, you can forget COVID exists for a few hours, but they're there, 24 hours a day, 7 days a week, the Unseen Frontline.